Hello and welcome to this month's edition of the Parents Know webinar series. I'm your host, Dr. Rebecca Jackson. I'm the Chief Program Officer for Brain Balance. And today we have a special guest with us, Dr. Mark Goldenberg, for our topic of understanding ADHD, a parent's guide to understanding what's really happening in the brain in ADHD, to better understand what are the strategies and supports you can put in place to make a true and impactful difference for your child. So let me start. I'm going to start by reading Dr. Mark's bio, and then we'll jump right into the conversation. So Dr. Mark Goldenberg, who is the owner of the Brain Balance Center in Norwalk, Connecticut, is a board-certified chiropractic neurologist and board-certified cognitive specialist. He specializes in the treatment of learning disabilities, dyslexia, attention deficit disorders, spectrum disorders, and is a fellow of the American College of Functional Neurology with the subspecialty in neurobehavioral disorders of childhood. His peer-reviewed paper entitled Hemispheric Integration Therapy and the Treatment of ADHD has been published in the Journal of Functional Neurology, Rehabilitation, and Ergonomics. Dr. Goldenberg has been practicing in his field since 1985 after graduating from New York Chiropractic College, and devotes all of his time to working with both children and adults with attention and learning challenges. And as I mentioned, he is the owner of the Brain Balance Center in Norwalk, Connecticut. So Dr. Mark, welcome.
Thank you, Rebecca. Nice to be here.
That's a long introduction. That's a lot of years of not only school, but just the hands-on learning that goes with it. I mean, I say all the time, textbooks teach you so much, but you learn so much more for the people and individuals you work with.
Well, I appreciate it. When these issues of neurodevelopmental disorders become personal, which they have in my case, you want to dive deeper and get answers. And over the years, we never stop learning. But this system really has given me answers that I really couldn't find in other research.
I love that you mentioned the personal aspect of it is when you're a parent and when you're an individual, if you're trying to figure out, why do you yourself struggle in some areas and succeed in others, when you're watching a child struggle, it does become so personal. And there is just that as parents, we want to do anything and everything we can to support our kids, but there's also that wanting to understand the why behind it so that we can make really intentional, great choices. I think that could take us in a whole different rabbit hole conversation. So in the sake of trying to keep us on track, I want to start just with digging into the first question, which is simple and complex at the same time in one question. But when we talk about ADHD, I think so often for many of us, there's a knee-jerk mental picture that comes to mind of the child that struggles with attention, behavior. I always picture, the fifth grade boy in the classroom falling out of their desk, that's disruptive, that's silly, that can be struggling with attention and behavior. Beyond some of those stereotypical symptoms, what's going on in the brain with ADHD? And then if you'll start high overview and then we can dig deeper and then talk a little bit about what we see with current research with ADHD understanding.
So that's a really great question, because the current model with ADHD is just as you said. We look at symptoms, parents fill out checklists, teachers fill out checklists. We end up with a T-score that if the score is above 60, typically you have ADHD. If the score is below 60, you don't have ADHD. But ADHD is much more complex than that. ADHD is a lack of typical development. This leads to developmental gaps from birth as the child's brain is developing. This causes a lack of connectivity in the brain. Now, we understand the brain has billions of neurons, these nerves, and trillions of connections. And all these connections have to fire and wire appropriately at the right times for the brain to function at any age for that age group. When you have this lack of connectivity, when you have developmental gaps, this results in symptoms. The symptoms that you just described: impulsivity, distractibility, emotional dysregulation, organizing, planning, prioritizing difficulties. So what we need to understand, it is very complex, and we need to understand that ADHD is really a dysfunction or a weakness in a specific part of the brain, which we call the frontal lobe, or really the prefrontal cortex, which is right here in the front. And that's called the executive. The executive makes all of these decisions. It's one of the highest levels of brain functions, which separates humans from all other animals. But what needs to be understood is that this part of the brain relies on many, many, many other parts of the brain, which we call lower level or bottom up systems in the brain. Visual systems, auditory systems, body awareness systems, even movement systems, and even brainstem systems have to all follow a very, very specific blueprint as the brain is developing. So if we look at the brain as a building, we have the foundation, first floor, second floor, third floor, fourth floor, and then we move up and up and up the chain in brain development to where we could make good decisions, control our emotions, have better frustration tolerance. But if these systems are not maturing correctly, we cannot expect the executive to be functioning the way it should. So we have to look at the brain as a whole and look at all these systems in the brain to make sure they have developed or are developing appropriately so that the child or the adult or the teen could make appropriate decisions and act appropriately and reach their potential for their age.
Dr. Mark, I'm so glad you talked about whole brain, because I think that's something that is somewhat unique to Brain Balance's perspective in how we approach and understand ADHD. And I'm glad to see, I'm seeing whole brain connectivity and whole brain health being talked about more and more. But I think so often we tend to focus on the symptom. What's the biggest fire that's happening in front of us? So if I'm a parent, what's the biggest pain point? Is it, getting through an evening and getting through homework without meltdown and disruption? Is it getting out the door on time? Is it making it to soccer practice with the soccer shoes? We so often focus on the biggest point of pain, and we don't always realize how interconnected so many different symptoms and functions are. And so it's so important to not just focus on what can we do to improve attention, what can we do to improve emotional regulation, but identifying what are some of those lower level brain functions and symptoms that may have a gap in development that's making it more challenging to build those more complex systems and functions on top of those original functions.
Well, that's exactly correct. So, and this is modern medicine in general, we tend to look at the symptom. So a symptom of inattention, a symptom of impulsivity. So a child will get a 504 plan, or a child will get an IEP. So they'll get accommodations, modifications, remediations. Those are really workarounds for the child's inability or the child's dysfunction, but they don't do anything to strengthen the actual underlying cause of why the child can't perform these activities that are expected of them. The other idea is that the brain has stamina, the brain has endurance. So when we have this underdeveloped system in the brain and we have these developmental gaps, the brain is like a muscle. If you have a weak muscle, you're not going to go and run a marathon. Or if you run a marathon, somebody's not going to tell you, okay, great job, let's run a second marathon right now. Well, that's what we're asking our kids to do. These children are using their brain all day long at school. At some point, there's nothing left in the gas tank. But yet, we're asking them to run that second marathon. Okay, great. Have a snack. Let's do your homework. Now let's do your worksheets. And the brain has no stamina left. What does that cause? It causes low self-esteem. It causes emotional breakdown. It causes the parents to be frustrated with their children because they might say, he's just lazy. We know he can do it, but he's lazy. Children are not lazy. Well, I shouldn't say. I have two kids. Sometimes they're lazy. But there is no child who just doesn't want to do well. It's just they have no control over this. And we want to give them back control. And we don't want them to start developing low self-esteem. The good news about the brain, it's moldable, it's changeable, and we could actually strengthen connections and strengthen pathways. But it has to be done appropriately. It has to be done in a progressively challenging way, targeted to those weakened brain systems. And now we get the brain to connect like a finely tuned orchestra, where all the players are playing at the right time, the right speed, and the right tempo. That music sounds beautiful. But if the trumpets or certain instruments are not playing at the right time, the right speed, the right tempo, we're going to walk out of that concert. So it's important to look at the whole brain, get the whole brain to connect. And as we all know, or I know you know, neurons that fire together wire together. And that's what we want to do. We want to improve connectivity and wiring in the brain, which absolutely can happen, but it has to be done appropriately.
There's a couple things I want to dig into a little bit further from what you touched on. One of the things is talking about when we think about a child's skills and abilities. In talking about ADHD, I heard you use some terms of dysfunction or challenge or struggle. And I think it's so important to understand that when it comes to ADHD, it doesn't mean that there is a struggle everywhere across the board. And I think that can make it really hard for a parent to identify, is this really a challenge? And is it behavior? Is it effort? Is it the environment? Or is there something more going on? And so when we talk about development and we talk about gaps in development, I think it's so important for people to understand that development is incredibly complex. And we've got multiple systems all growing and developing and intertwining and working together at the same time. And while most systems should be developing together, there are times, and this is what we see in the case of ADHD, where some systems are developing at a different rate than others. So we end up with disharmony, or we end up with asynchronous development. So you can have a child that is incredibly gifted in many areas, but still has a struggle. And I find that sometimes as a parent, we can look to the giftedness to think that maybe it overcomes the challenge. Both can be true at the same time. You can be amazingly intelligent. You can have a great sense of humor and still struggle with emotional regulation, executive function, and attention. The one doesn't negate the other.
We see this all the time. And the first thing I say to parents, pretty much all the time, is your child is gifted in many areas, because that's exactly correct. But there are other areas that are underdeveloped. And the brain doesn't really like that. So the brain likes everything to kind of coordinate and connect appropriately. So if we could identify these underdeveloped systems and bring them up to a point where they're equaling those gifted systems and now everything is coordinating correctly, now we have a celebration. So that's what I try to tell the children. And when they walk into the room, I say, you play any sports? Yeah, I play football. Well, your coach is going to see where you really have talents, but maybe there are areas in your game that the coach needs to work on, that you could improve. How does that sound? Don't you think it would be great if we could improve those areas that you need help in? Oh, yeah, that would be great. And that's what we do with Brain Balance. We celebrate the gifts and we build up the weaknesses. And that's exactly correct.
And
one more thing, I just want to say, so as this continues, we do not want those gifts to be diluted, because as the child continues with these underdeveloped systems and starts developing low self-esteem, that could dilute these gifts and they could start feeling bad about themselves and spiral downward, which we see a lot when I start seeing 14-year-olds, 16-year-olds, 18-year-olds. So this is a very, very important piece to that.
I want to come back to the superpowers with ADHD in a little bit, but before we jump into that, you talked in the beginning about the subjectivity of how ADHD is diagnosed. It's diagnosed by a list of parent-reported symptoms, or parents are answering questions on a survey, which is at this point considered the gold standard for an ADHD diagnosis. Is parent perception, teacher perception, clinician perception. One of the things that really excites me that we're seeing in the research and what's happening in brain health and science today is understanding the more biological nature of these things, and with the ability in the future to move beyond just purely subjective. And that information is important, but there are structural differences in the brain, and it's expensive to do brain imaging in order to come up with a diagnosis. But I'm really excited about some of the work coming out where they're seeing, for example, differences in eye movements in an individual with ADHD versus non-ADHD. So I'm excited to see how there's some very low cost, but objective and reproducible measures. And it's because this isn't just behavior, that there are structural and biological differences that can be measured in an objective fashion that we can also see change. So while we do know now that ADHD is considered a lifespan disorder, we see it at Brain Balance all the time, that you are able to reduce and influence some of the challenges and complications that can go along with ADHD. So I'm excited that we're moving beyond just purely symptomatic criteria for classifying ADHD?
It's a very good point, Rebecca. And one of the areas that was actually, one of them was invented by Harvard called the quotient ADD test. But we actually do an assessment here at Brain Balance. Hold on one second. So we actually are able to look at a child's ability to fixate. What is fixation? Fixation is being able to stare at a point on a screen, for example. Now, the eye should be able to have the ability to keep focused on that dot. But when you have so much activity going on in the brain, when you don't have systems that are actually calming the brain, because there are activating brain systems and calming brain systems. And we want to have a little activation and a little calm, a little gas pedal and a little brake. But when we have underdevelopment in the brain or imbalance in brain development, those quieting systems are not occurring. So we see the eyes actually jumping, even though the child feels they're staring at a dot on the middle of the screen, the eyes are actually micro moving all over the place. And this is an indication that there's just too much noise or activity in the brain. So actually getting a window into the brain through the eyes, exactly the way you said it. Now, when we finish program and we redo that test, those eyes are fixated right on that dot and we don't see that micro movement, which was duplicated in a study done by McLean Hospital at Harvard by Martin Teicher, showing that exact improvement.
And I think we see that also, you're talking about the movement of the eyes, but the movement of the eyes, as you say, is a window into the brain. We see movement reflected in the body as well. So I'm going to segue into talking about the differences in presentation with males versus females, and then we'll talk about age distribution as well and how ADHD can present so different. And I think something that I'm glad to see being dug into further right now is a better understanding of the impact of ADHD on girls. For so long, so much research has been focused on the male population, and I really think that that's starting to change. And I think males with ADHD has tended to be more of the big behaviors, more of the louder disruptive behaviors, which led to earlier awareness when it's more disruptive in the home and classroom. So we're seeing today that there's a rising awareness that ADHD also impacts females. But we're seeing right now that there tends to be a 2 to 3 year lag in when females are diagnosed with ADHD compared to males. So Dr. Mark, will you talk a little bit about kind of some of the current research and understanding the difference in ADHD presentation in males versus females, how that could differ and how it comes across, and why? Why are we seeing those differences?
So you're absolutely correct. So the current statistic basically is around 12% of boys are diagnosed with ADHD, whereas around 5.5% to 6% of girls are diagnosed with ADHD. But that statistic is really skewed because, as you said, they are presenting in totally different ways. And this really relates to the hormonal system between boys and girls. So boys have an increase in testosterone. When you have an increase in testosterone in the brain combined with parts of the brain that are not calming down and are imbalanced, you're going to have more hyperactivity, emotional dysregulation, impulsivity, social issues, low frustration tolerance, poor coping strategies. Now, estrogen, which is found more in the female, has more of a neuroprotective effect. So a female with ADHD will not present with the overt symptom that will get a teacher's attention. So they might be calm in the classroom and the teacher's pet, oh, she's so sweet, she's so lovely, but her mind is wandering. She's inattentive. She more internalizes her feelings. She could develop depression. She could develop anxiety. These could all be signs of ADHD in a female. However, that might be not diagnosed because they're not overtly showing themselves, number one. But number two, they might be diagnosed as a different disorder. So they could be misdiagnosed as depression or anxiety, when in fact, it could be a symptom of the ADHD. So males and females absolutely show different presentations. And obviously in a classroom setting, the teacher is going to be more aware of the child who's causing trouble. than the child who's just sitting there mind wandering, but it's not giving the teacher any trouble. So I think that's a big issue that needs to be addressed, because I think females are being misdiagnosed or not being diagnosed at all.
So if you're the parent of a female and you're wondering, is my child struggling with attention? What are some signs and symptoms and things that a parent can be watching for in a female in third, fourth, fifth grade, a young girl, that might help them understand what some of the underlying struggles or challenges may be?
A lot of inattentiveness, talking to your child and they seem like they're not listening to you, or asking your child to follow certain multi-step instructions and they're just kind of mind wandering and not paying attention. Or the female child might have anxiety or look like they're developing low self-esteem because they're trying their best. And what's very important here is to understand that they have no control over this. Children, even teens and even adults, have no control over this. And we expect them to have control over these systems in the brain. So when you're trying to do your best and you have no control over something, you're going to start developing low self-esteem, especially when adults are telling you, what's wrong with you? I just told you that a million times. Hey, Mary, aren't you listening to me? Mary's mind is wandering. There's a specific part of the brain called the default mode network that involves the brain more internalizing and thinking to itself. If the other system that's supposed to wake up and interact with their environment is not working, well, they're going to stay in that mind wandering mode. So this is very important. So it's really important to, just look at all these different signs and say, hey, this just doesn't seem right. If it doesn't seem right as a parent, I would take the parent's word over any physician. I lived it myself. And what does the doctor say? Oh, they're only 7. Let's wait till they're 9. Well, this is normal. He's a boy. So he's roughhousing. That's fine. He's normal. But parents know. Parents have an idea. Well, I know, but kind of not acting like all the other kids, or just doesn't seem like it's typical. If you feel that way, have an assessment, get it checked out, and don't take a wait and see approach. The worst that could happen is there really is no issue.
Yeah. We were talking about the wait and see approach earlier. And I think, I do think that there's a time for wait and see, and then there's a time for action. I think one of the things that's frustrated me when it comes to ADHD over the years is that first line of defense all too often is medication. And I am not anti-medication in the least. There is a time and a place. But the parents that we interact with over and over again, oftentimes they're not wanting to jump to medication first, or maybe they're wanting to try something before doing medication, or they're doing medication and it's not enough. There's still challenges, there's still struggles, and they don't know where to go from there. So I can understand the wait and see approach when it's a parent that's hesitant to want to put medication, to prescribe or to use that prescription for their child. But I think, to me, knowledge is power. And so starting with an assessment, that to me is something that I wouldn't recommend a wait and see. I want to capture information and data on my child's development today. So I've got a clear picture of where are they today, so I know what I can do to better support development going forward. And so I can understand where the wait and see approach comes from of maybe you're not ready to see if a diagnosis is appropriate. Maybe you're not ready to consider medication. And I think that's okay. But I wouldn't wait and see to capture quantifiable information that could help to provide directional information for support.
I agree with you 100%. And I am not some fanatic against medication.
Mm-hmm.
But we do know that once you take the medication away, if it helps the child, which around 50% of the time it might make a child more vigilant, maybe being able to be more goal-oriented. But we know there are side effects to medication. And when you take the medication away, the problem comes right back. So we want to address the brain in a way that could strengthen these systems more long-term than just putting a Band-Aid on it with medication. Because, and I won't get too heavy into this, we know there's a concept called tolerance. Tolerance means that you could give a medication that seems to be helping, but after a while, the brain gets used to it. And the brain tends to protect itself by pulling away the receptors that allow that medication to stimulate the brain. So then you have to keep giving more of the medication to get the same result. And that's called tolerance. So the more we give the medication, we can get other side effects. So, look, we always want to go from conservative to higher interventions. If you don't need surgery, you're not going to jump into surgery. You're going to try to do something less invasive. I think medication is more invasive. Doesn't mean you can't do both at the same time. I have many children who are on certain stimulants or second line ADHD drugs like more blood pressure medication like guanfacine, things like that. Which, look, if you have an injury and you need to take nonsteroidal anti-inflammatories to get through rehabilitation, there's nothing wrong with that. But the nonsteroidal anti-inflammatory is not strengthening the muscle. It's not strengthening the joint. That's what you want. You want long-term strengthening. So hopefully that kind of answers your concern.
Well, I think it brings us back to that whole brain conversation. Is, we talk about so many of the symptoms from ADHD originate from prefrontal cortex, but yet we know when we look at the whole brain in an individual with ADHD that there can be differences in balance, in coordination, in multi-sensory processing. So there can be differences in every region that then all contribute and provide information to prefrontal cortex. So prefrontal cortex, as you described, can be the conductor of the orchestra, the executor, to make decisions and perform. And while medication can reduce some symptoms, which again, there's a time and a place, and that can be very helpful, we see that it can increase seated work time, but it doesn't necessarily change the learning outcomes. It doesn't necessarily change the underlying structural connectivity that's needed to support attention, emotional regulation, and behaviors, because those are coming back to these foundational functions and systems that need to be built and matured upon. So now I'm going to segue us into a conversation talking about age. So we talked about differences in how ADHD can present in males versus females, but I also think we could see a very big differentiator in how ADHD presents in older versus younger. And one of the things that I've really noticed over the years, especially when a parent's taking kind of a wait and see approach or observing their child over the years, is I feel that there are these flush out periods, these times when the executive function demands of life have increased. So maybe you're shifting from 5th grade to middle school, or middle school to high school, or you've gotten a promotion at work. There are these times in life when the demands increase, and with healthy development, our brain should be able to handle increased demands over time. But I find these flush out periods where there's been an increase in demand, and maybe the child was working really hard to stay caught up and was mostly caught up with some challenges. And then all of a sudden parents feel like, gosh, it just all fell apart this year, where parents find themselves having to lean in more to help and support rather than the child becoming more independent. So talk to us a little bit about differences in how ADHD can present in adults versus kids, or even young kids versus middle school and high school.
So that's a great point. So the brain has stamina, the brain has endurance. As we said before, many of our kids are gifted in many areas. Those gifts could carry a child so far. But we all know the term, we're always as strong as our weakest link. At some point, that link is going to be tested. And now the child starts to struggle. Oh, he always did his homework in 1st grade and kindergarten and in 5th grade. Now he's in middle school. Well, now he's in high school and he can't keep up with the work because the demands on the brain are becoming more and more and more. And when we have this underdevelopment or low stamina or low endurance in these parts of the brain, now those systems are going to be overworked and short-circuited. So now we have to organize more, prioritize, plan, make decisions, emotional control. These are things we see mostly in teens or even high schoolers, or as we get into middle school, higher in middle school. those demands of independence, kindergarten, first grade, elementary school, pretty much teachers are helping them, parents are helping them. But now, for some miracle, we feel once a child gets into middle school or high school really, they're on their own. Okay, you're on your own, you're in high school, you should be on your own. But if you have an imbalance in brain development and you have these underdeveloped systems and you have these gaps in development, that's not the answer. So now I have to organize. Now I have to write this paper. Now I have to stay up and do this work. Now that's where we see the teen struggle in the executive functions of organizing, planning, prioritizing, decision making, emotional control, even social ability. The social demands of a teenager are tremendous with social media, with electronics, with all this stuff. So that's important to realize that a teen can manifest in these issues as they get older. Not to say they wouldn't have these issues growing up, but a child is more of the impulsive, emotional reactivity, externalizing behaviors, disruptive in the classroom. But as the child develops, they kind of understand, well, I can't be kicking the table over in high school, but we see a shift in different types of stresses that are put on the brain and different challenges that are put on the brain in those areas of executive function in teens and absolutely in adults.
Yeah.
No,
Dr. Mark, your sound was cutting out a little bit. It almost sounds like the microphone was muffled.
oh, mine?
Yeah, there you go. That sounds better.
Oh, sorry about that. Did you get what I said?
It was just a little muffled. I could hear you. You just had to listen a little bit harder.
Okay, sorry about that.
That's
But yes, teens and children manifest in different ways because a child's brain really doesn't have to do too much organizing, planning, prioritizing, maybe put your soccer bag in the laundry room or maybe get your t-shirt out. And even that is a challenge in a lot of children with ADHD. But when we get into the high school, college years, that's when we really, really, really have to have a finely tuned, high functioning executive of the brain to be successful.
Yeah.
And that's where we see children, young adults and teens and adults fall apart.
And that's, when I'm talking with somebody and there's questions around, is this ADHD? Is this not? Is there something more? And to me, it's not about whether or not we're diagnosing it. Is tell me what the challenges and struggles are. Is this something that by strengthening networks and pathways in the brain, strengthening systems in the brain, we can see a difference in symptoms? And my first questions always relate to executive function. So when we think about executive functions, our primary executive functions are our ability to direct and sustain attention. It is our response inhibition. Can we control our actions and reactions in the appropriate times? And it's working memory. So those are our three core executive functions. But then there's multiple that go below that are a combination of all those, including how do you regulate your mood and emotions, your ability to direct your goal-oriented behaviors. If I want to get a good grade in this class, can I get the homework done and turn it in on time? Can I manage my time so that if I have a test on Friday, that I'm studying all week and get my project done for the other class on top of that? And so I always start with questions around executive function, because if I'm hearing challenges come through in that ability to direct and sustain attention, to hold information, working memory, to then act on it, then to me, that's a red flag that there are potential immaturities in systems that can be strengthened to be improved, because we all depend on executive functions to be successful in life. So if we've got an opportunity to strengthen those systems, that's only going to have a positive impact in life.
You are absolutely correct. And, when you talk about working memory, that's a very specific part of the brain. It's a very specific part of the frontal lobe and what we call the dorsolateral prefrontal cortex. But if that system is weak, or if that system is not connecting appropriately, it is unrealistic to expect an individual to be able to hold those pieces of information. Okay, I have work and I have to do this project, so I better get it started now. And then I have a 12 o'clock meeting, so I better finish by this time, and plan out your day. Planning and prioritizing is a high level brain function. But if those systems are not coordinating and connecting correctly, you can't expect an individual to perform like that. And they're all dependent on these other systems that have to feed into that higher level frontal part of the brain. That's why we keep talking about bottom-up development. The visual system has to send signals. The auditory has to send signals. Your body awareness system has to keep you alert and understanding where you are in space. That's a very, very important system that connects to the part of the brain that has to do with self-awareness, self-reflection, self-realization. These things are high-level systems, but they depend on these proprioceptive or body awareness systems to feed into that system. If these systems have never been developed from birth and through childhood, we're going to have these developmental gaps and these struggles in life. The beauty about it is that we can identify these underdeveloped systems and these gaps. And once we can, we could activate the brain in very specific ways to strengthen these systems at any age, any age.
You know, another thing that really struck me, and sometimes you just hear a line or a phrase that resonates and it sticks with you. And one of those lines for me is the realization that our brain is constantly asking ourselves the question, is the effort worth the outcome? Is it worth it? So when we think about, for you and I, we've got the ability with executive functions as an adult to work for a very, very, very long time before we're rewarded with a benefit from that work and effort. And sometimes there's not a reward at all. It's just something that we need to do. But when we think about somebody, I think the younger you are, or the more immature development there is in pockets, then oftentimes it requires that individual to put in more work and more effort to accomplish the same thing. So when we say to our child, hey, I want you to go clean your room before dinner, and they don't do it, internally their brain's saying, that's a lot of work. What am I going to get out of this? I'm going to choose not to do it because it doesn't sound fun. So if you're somebody that has a hard time organizing, a hard time getting started on a task, something as simple as cleaning your room can feel really, really overwhelming. And when we feel overwhelmed, the brain's going to go negative and shut down. And so I think that's another thing to watch for is when you're asking your child to do something that feels simple to you that they're not doing, understand why. Is it because they don't have the tools or the resources? You talk about endurance with the brain. Am I asking them to do something beyond their resources? Have they run out of endurance, but yet I'm asking them to use their brain? So do they have the tools and resources to do what it is that we're asking them to do? And if over and over you're seeing a lack of follow through, a lack of action, a lack of performance, I think it's because often internally their brain's saying, no, the outcome's not worth the effort. I don't want to do the math homework when I know that I'm still going to get a poor grade. I don't want to work hard on my handwriting. I don't care what my handwriting looks like. I don't care if you can read it or not. And so I think that it can play out in looking like challenging behaviors or poor behavior when the reality is their brain is saying, I don't really have the tools and resources to do what you're asking me to do, and it doesn't feel worth it to me.
Well, so that's it. So that goes back to no gas left in the gas tank.
Mm-hmm.
So if your car has no gas left in the gas tank, but yet you have to drive 5 miles, it's not going to happen.
Mm-hmm.
You know, there's also a piece of this that, yes, low stamina, low endurance. I just don't have the endurance to do it. It's not worth it. I don't want to do it. But there's also, you mentioned immediate rewards, delayed rewards. You know, at some point in child development, we do develop the ability to have a delayed reward system. And this is a very mature system that's really not found in younger children. Okay, so if you can do this for 3 or 4 days, or you could do this for a week, you're going to get a reward at the end of the week. Oh, wow. Okay, I'm going to do it. Perseverance. That's a delayed reward. That's a very high level system. But in our society, we are really geared towards immediate rewards. This is found in computers, electronics, so many areas, social media, so many areas of our life rely on immediate reward systems. And that's not really a great system, because the immediate reward system is a system that pumps dopamine into our brain. Dopamine is the chemical that is found in most stimulants. Well, I'm sorry. Dopamine is the chemical that is triggered to be produced in the brain with stimulants. And it could cause an addictive type of behavior. If I don't get an immediate word, I don't want to do it. So we don't want to foster this immediate reward environment. And that's why electronics, these games, really should be monitored very, very closely and not introduced until later on in life when the brain is more fully developed.
And I think it's important to when we talk about dopamine, dopamine's not good or bad. Dopamine drives our actions, it drives our behaviors, it's a motivator. When dopamine is released and then absorbed in the brain, it gives us, energy and motivation. So dopamine is released when we set a goal. So if I decide to sign up for a half marathon, I get really excited about it. And then dopamine's released when you accomplish that goal. So dopamine's released when we learn something new that really resonates with us, that we're excited about. Dopamine's released when we have connections and are laughing with friends and family, with great music, with good food. So there's a lot of, we talk a lot about dopamine, but to me, dopamine's not good or bad. It's necessary, but it's what is triggering the dopamine release for your brain. And our brain is all about habits and patterns and routines. So the more you do something, the more easily those pathways are used, which makes it easier to access the dopamine from that pathway. So I think, as you were talking about with technology, that's a great example. If you're gaming all the time, you're training your brain to get that feeling of happiness and motivation and energy from the video game. But we want to train our kids' brains to feel happy and motivated through interacting with friends and family, through exercise, through movement, through learning about something they love. And I think that goes along with your instant gratification versus delayed gratification. We want to build the delayed gratification reward systems so that we're seeking dopamine in positive ways through positive actions. But I think when we've got a brain that has aspects of immaturity, which means I'm going to have a harder time self-regulating, I'm going to have a harder time walking away from something, it can make it a more slippery slope with those instant gratification dopamine reward options.
You're right on. Dopamine is critical. As a matter of fact, a lack of dopamine or a pathology of dopamine is called Parkinson's disease. Yeah. So we absolutely need dopamine. Mm-hmm. But as you say, there are times when the typical dopaminergic system should be activated. Mm-hmm. But when we overwork that system and rely on these immediate gratification, immediate reward systems, we're pumping dopamine. So now the brain has a different level of requirement for dopamine. Mm-hmm. And it can only be reached through these immediate reward systems, these games, even going into drug use, mm-hmm. cocaine, crack. Most psychoactive drugs rely on boosting the dopamine system to a level that's really not appropriate for the brain through evolution. Mm-hmm. But now the brain is used to this big boost. And if you don't get it, depression, and all these things happen. It doesn't have to happen with psychoactive drugs. It could happen with electronics or anything that really pushes that immediate reward system on a regular basis and over time.
I'm going to shift our conversation slightly now. We've talked a lot about ADHD and how it can present different in males versus females. It can present different at different ages. We've talked a little bit about medication. Let's dig into a little bit more when we think about traditional strategies and support mechanisms for parents. If you're a parent and you suspect your child has ADHD, or maybe recently diagnosed, or maybe there's a diagnosis that's been present for a while, talk a little bit about kind of the approaches with some traditional strategies, and then how brain balance fits into the picture with that. How and why the brain balance approach differs from traditional ADHD support interventions.
So the brain balance approach is not a panacea. It's not, brain balance is everything. Brain balance is a strong part of building up brain development. However, healthy lifestyle, breathing techniques, yoga, meditation, sleep, diet, all improve brain function and relax brain function. Those modalities are critical for just keeping the brain at a certain level of relaxation oxygen flow, exercise absolutely is critical. Where brain balance comes in is that we are now digging deep into the underlying systems in the brain that are not developing correctly. Those other techniques are very good for relaxation, for really working on more of the internal and cognitive pieces of the brain. But those together with now building up those systems in the brain and strengthening brain development and filling in those gaps and improving synchronization, that's the magic sauce. That's the formula. That's why at Brain Balance, they just don't come here for sessions or they just don't get stimulatory sessions. We talk about diet. We talk about exercise. We talk about all these other things which are critical. So it's synergistic to those systems. Even with 504 IEP, all these accommodations, modifications, remediations. Our goal is to allow a child to be more functionally capable of benefiting from those systems. So there's so many other excellent modalities, plus building up the brain from the bottom up, which really completes the whole picture. If you just do breathing, okay, might you feel calm for a little bit? Yes. But you're not addressing the underlying developmental gap that needs to be addressed, and you're not addressing the brain lack of connectivity and synchronization that needs to be addressed for the whole brain to work and improve whole brain health.
Yeah, that was just said so well, Dr. Mark. I think, to sum it up, I think when ADHD originally was thought about as attention and behaviors, then the interventions and strategies were focused on attentions and behaviors. So how do we give parenting support to manage behaviors? How do we do classroom support to manage behaviors? How can we provide a medication that can reduce behaviors? But I think as our global understanding of ADHD and the impact on whole brain development, connectivity, performance has come so far. ADHD is one of the most well-researched topics in childhood. We have so much of a better understanding of it today that our interventions and approaches need to change with what the research has taught us about the condition, is that there are structural differences in the brain. There are asynchronous aspects of development that can make daily life more complicated. And so that gives us an opportunity to then seek out interventions that can have the ability to impact whole brain development and whole brain connectivity.
And parents are now much more sophisticated in researching and wanting to know answers as to what's going on in my child's brain.
Mm-hmm.
Does my child have ADHD? Okay, he needs medication. No, what's going on in my child's brain? How could I help my child? So the research is coming out. Parents are more aware. They want answers. They want to know really what's happening in the brain. And that's what we try to tell them and help them with and give them answers here in Brain Balance, rather than just saying, your child has ADHD. Here, try this medication or psychotherapy. There's nothing wrong with psychotherapy, but those are known as top-down approaches. We need top-down and bottom-up together.
I'm going to end with one last talking point, and then we'll open it up. We've got time for a few questions here at the end, but I want to touch a moment on ADHD superpowers. And I love that there's been this culture around, let's better understand ADHD and let's celebrate all aspects of my child. And so when we talk about ADHD superpowers, one of the things that comes to my mind is difference in those attentional systems. So as you mentioned, that default mode network, that's the part of the brain that's active when our mind is wandering. And when mind is wandering is when we can have a lot of creative thoughts and brainstorms. It's also when our mind is scanning the past. So we might be, having a memory from something long ago or scanning towards the future. So maybe I'm worried about something coming up. So this increased time spent in the default mode network can result with some really amazing creativity. It's also where we can see some increased anxiety come in because you're worrying about things from the future or worrying about something that happened in the past. But I think it's really important to understand that somebody that has amazing creativity, strengthening the attention systems that allow us to direct and sustain attention don't take away that creativity, but instead it allows us to shift into the appropriate use of attention in the appropriate moment. So when you're sitting in a math classroom and your mind's wandering and you catch yourself, having that ability to say, wait, I can think about that later. Right now, I need to listen to the teacher. So that's one of the thoughts that comes to my mind. What comes to your mind when you think about that, the comment and culture around ADHD superpowers?
Like we said in the very beginning, a lot of these children and adults are gifted.
Yeah.
You know, I've had children come to my center and they show me their artwork. And this artwork was done during a class. So they were teaching social studies. But this child just started doing their artwork. I mean, this child should be a professional graphic artist. These kids are 8 years old, 10 years old, and it looks incredible. So, yes, they have these superpowers. There's no doubt about it. There are incredible gifts in these child's brain. But these gifts have to be expressed at the right time. But when we are in this default mode, you mentioned the default mode network, the mind wandering network, the teacher's talking, but okay, wow, this really looks good. I want to do this cartoon. There should be another network coming online called the Salience Network. Okay, that's great. But now this is what's happening. So let's turn that off, and it actually turns off. So we could now adapt to something that's important in our environment. So what's that require? It requires the auditory system to be functioning correctly, the visual system to be functioning correctly. All these systems have to function for that salience network to say, okay, great, stop that, let's listen to the teacher. But if these systems are not coordinating correctly, then that higher level system is not going to work correctly. So yes, these superpowers are quite evident. There's no doubt about it. We want to bring up these underdeveloped systems to match those super systems. And now we have a big celebration.
Yeah. All right, so I'm going to do a quick summary recap of what we've discussed for the last 50 minutes, and then we'll jump into questions. Let's see if I can recap everything. So really, in talking about ADHD, we've dug into the fact that it's not just behavior, it's not just symptoms, that there are structural underlying reasons why there's additional challenges and complications in daily life. And oftentimes you can really see it impacted in executive functions, the ability to have those goal-oriented behaviors, to follow through, to regulate mood and emotions, to have age-appropriate social interactions. And when ADHD is present, we can see greater struggles and challenges in those areas. And it can look different in males versus females. It can look different in young kids versus adults, but it does come down to structural differences in connectivity in the brain. We've dug into the fact that while so many of the symptoms of ADHD come from the prefrontal cortex, that it requires all of these foundational brain systems providing the correct information at the correct time so that the executive of the brain can make the appropriate decisions and actions in the correct moment. And when there's a disruption in any one of those systems, it can disrupt the ability for the executive of the brain to make the best and right decisions. We also touched on the fact that when ADHD is present, there can be a lack of endurance in the brain. So it doesn't mean that there aren't gifts and skills and abilities, but that individual may have a harder time maintaining those abilities over a longer period of time. And as a parent, to trust your gut if you have questions, if you have concerns. While there's a time and a place for wait and see, and there's a time and a place for medication and many different interventions and strategies, when it comes to finding out information, starting with an assessment can equip you with knowledge to say what parts of my child's development are on track and are there gaps present that might make things more challenging. Did I miss anything key there?
No, I think you did a great job, Rebecca. You have good working memory and you have a very good attentional system, it seems like.
And I also take notes as I go, so that helps as well.
And I know you run every day, so you have a lot of oxygenation in the brain.
I do. The lifestyle pieces are tremendously important to me because the more we learn about brain health and development, and one of my favorite lines too is understanding that your child's development today is the strongest predictor of their abilities tomorrow. So gaps in development as a child present as greater challenges with emotional regulation and with executive functions as an adult. So as an adult, to maintain and optimize my executive functions, I try to prioritize sleep. I exercise nearly every morning. I work hard to eat healthy. I'm not perfect. There's a balance, and there's always room for improvement. But our abilities are also dependent on brain health, and brain health is tied to our development and our lifestyle. So with that, Victoria, if you're there, we'd love to bring you on. I forgot to tell people that they could type in questions at the beginning. I forget that almost every time. But if we have any questions, we'll be happy to answer.
Thank you, Rebecca. This is just such an insightful conversation. I appreciate you both. We do have a number of questions, so we'll ask. I think we have time for about 3, and then we can get back to people individually as we go. So the first mom said, I appreciate this information about ADHD medication. My son is currently on medication. I'm afraid to take him off because of the medication he's on, as it's really helped him stay on task during his school day. Do we have to be medication free to start the Brain Balance program?
So you do not have to be medication free to be on the Brain Balance program. And I'm happy for you that your child is getting a positive response from medication, because it just doesn't happen all the time. So what you need to understand is, once you take the medication away, the problem's going to come back. So while your child is on medication, we see many kids on medication. As we're building up the brain to improve brain connectivity and brain function, for the possibility that they will not need medication, because now the brain is connecting and maturing in a more appropriate way. So I think I gave the analogy earlier that if you have an injury to a body part, you might need to have a nonsteroidal anti-inflammatory medication to get through rehabilitation or physical therapy. But the medication is not strengthening your muscle. The medication is not strengthening your proprioception or body awareness. That has to be worked on physically, like we work on the brain physically. So I hope that answers your question.
Yes, thank you. Another mom asked, my 8-year-old son has ADHD and I feel like he can try harder, but chooses not to. Sometimes he can stay on task for morning routines or for homework very easily, and then most of the time he doesn't. How do I help him just try harder?
So chances are your child is trying as hard as they can. Or they have tried and tried and tried and tried, but are not meeting the mark that you as a parent have set for them, or the teacher has set for them. So they might be developing low self-esteem and just giving up. But the brain has stamina and the brain has endurance. We reach a point, a threshold, where there is just no, and I like to use this term all the time, there is no gas left in the gas tank. But you're expecting him now or her to continue to work when there is no stamina left in the brain. Your child is not lazy. Your child, there's really no child who just doesn't want to do well and wakes up one morning and says, I just don't want to do well. I want to fail. No, it doesn't work like that. There are, over time, the child has tried and tried and tried and tried, but can't get over that hump. So your child we really need to see where those gaps are and where that stamina is lacking, and the brain, being like a muscle, can be strengthened. Absolutely. It's a term called neuroplasticity. You could look it up. The brain is moldable, the brain is changeable, but it has to be done in a very specific way.
And I think it's helpful if we think about this in terms of what's a short-term strategy and what's a long-term strategy to help your child. When you think about a child who's run out of the gas in the tank, they've run out of the endurance and stamina, some ways that we can re-engage in that moment, maybe you still have homework to get through that night, is fuel. And so making sure that you've got protein, healthy fats, carbohydrates, that could be a way to provide more resources for the stamina. Exercise, taking a few minutes to spike the heart rate and engage the core muscles, that turns on the brain to help increase alertness and engagement. So again, if you've got homework that you've got to get through and they're just done, shifting gears to movement and a snack can be a great way to then re-engage that brain. But then that's also a red flag to tell you that more is being asked of this child than what they're capable of consistently delivering on, which can be a red flag that there's gaps in development. So they're having to work harder to accomplish the same thing. So that long-term strategy is then targeting the brain to build and mature the connectivity and development of that brain through programs like Brain Balance, so that long-term they've got the skills and abilities to meet the demands of life being placed on them.
Good points.
Okay, another one, and you sort of touched on this a few different times, but I think we'll wrap up with this question. This woman says, my daughter is really struggling with staying organized since starting high school. So she just started high school, navigating between classes, forgetting assignments, forgetting homework. I feel like it's been a huge change since middle school. When you discussed executive functions and ADHD, how can I tell if she may have ADHD and issues with executive functions versus just trouble adjusting to high school, I guess, so far?
So we did touch on that in a way that stated, again, these children have gifts, they have underdevelopments. So your child possibly was using all their gifts to get through that middle school. You say the child was in high school or college?
In high school, just starting high school.
So the demands in middle school are different than the demands in high school, and we're only as strong as our weakest link. So at this point in time, we are now reaching a point where the demands of high school are going beyond her threshold. Whether you call it ADHD or not, it really doesn't matter what you call it. What you want to understand is what's impacting the brain, where are the imbalances, how could we strengthen the brain so that your child can meet the demands of a high school student and start to organize, plan, prioritize, and make good decisions, which really involves strengthening not only the frontal part of the brain, which those attributes occur, but by looking deeper and seeing what we can do now to build up total brain health by looking at these bottom-up systems of getting your child's brain to have superpowers in all areas of life so they could be and reach their potential.
Okay, well, thank you, Dr. Mark Goldenberg and Dr. Rebecca Jackson, for this, again, insightful conversation, a parent's guide to understanding ADHD. I have a much greater understanding of ADHD, even given all of my years of experience listening to the two of you talk about this topic, and I really appreciate you. We have a lot of thank yous today in the comments, and just appreciate your time and thoughtfulness in this conversation. To our audience, thank you for joining us for this ADHD Awareness Month special edition of our Brain Balance Parents Know webinar. You can check back on our website, which is brainbalance.com/webinars, for our next live event, which will be at the beginning of 2025. So stay tuned for that. And thank you again, Mark Goldenberg and Dr. Rebecca Jackson. And we'll see you soon.
Beginning of 2026. This is 2026.
Oh.
Yeah. Thanks, everyone.
Thank you, Victoria.